3, 2, 1. Dr. Sanjeev Kanoria, you are the chairman of Advinia Healthcare, and Dr. Chris Papadopoulos, you are leading the way with care robots at the University of Bedfordshire. Gentlemen, welcome to the Care Home Show.
Thanks for having us.
Pleasure.
It's an absolute pleasure. So you guys are working together at Advinia and the University of Bedfordshire on a pioneering robotics programme. Tell me a little bit about that to get things started.
Sure. So the project is called Caresses. It's an international collaboration between various institutions across the EU and Japan. Mm-hmm. So it's quite unique in the sense that there's a collaboration between EU and Japan. Those kinds of studies are far and few between. Mm-hmm. The point of the study is to develop a social robot that has cultural competence. Mm-hmm. So that takes it takes a lot of doing to just create the artificial intelligence and put that in. Mm-hmm. So that's a significant part of the work. And then stage 2 is to trial it in real care homes through Advinia's care homes. And that is the part that Bedfordshire and Advinia are leading, so the actual trial itself.
Trial process itself. Okay, understood. Okay, we'll get into that into the discussion, but I'd like to ask a little bit about kind of your own individual journey. So, Sanjeev, tell me a little bit about how did you get into the kind of health and social care world?
The health world was a passion for me right from the time I was a kid. I wanted to be a surgeon, and I worked hard for it. I graduated in India. I came to England in '89. Mm-hmm. I got the fellowship of the Royal College of Surgeons within a couple of years, became a young surgeon, trained very hard. And then I wanted to do an MBA and bring a different aspect of management skills to medicine. So I took time off to do an MBA from London Business School and from Kellogg's. And then McKinsey came along and offered me a job. So I said I would work with them for 2 to 3 years and then go back to medicine. Mm-hmm. But after this 5-year break from surgery, no one wanted me back in medicine.
Right, okay.
I was desperate to become a liver transplant surgeon. I'd already specialized in general surgery, but those times people didn't understand why someone would leave medicine to do management and then want to come back again. Right. So this was way back in 96, 97. So I decided, okay, well, what do I do? I need to get back into medicine. That's my passion. So I gate crashed into King's College Hospital, the liver transplant unit. I told them, you have to give me a job. Give it to me for free for a year. Let me prove myself. Mm-hmm. So they said, okay, fine. We'll give it to you for free. You become an honorary fellow. And but I didn't know how to support my family and myself. So I released equity from my house. And we went and bought a care home because I'd done quite a bit of work on care homes when I was with McKinsey. Mm-hmm. So the whole journey started as a lifestyle business to support my career aspirations in surgery. And that's how we started. But I was able to bring my management skills. We improved the care home. I continued to train at King's. I got an opportunity to get my number back, my surgical training number back. I got back into mainstream surgery. I had an innovative concept for reducing liver injury following transplantation, and that became the subject of a PhD. Okay. So that was conditioning another part of the body or causing a minor stress to another part of the body to reduce injury to the liver. We called it remote preconditioning of the liver, and I got a Category 1 PhD from UCL on my work, and there's a large clinical trial now going on at the Royal Free Hospital based on some of the work that I have done. So that makes me feel very happy and glad that that journey came to fruition and society could benefit. So I trained as a liver surgeon, but at the same time, I continued to buy more care homes. We put a management team together, and now we have about 3,300 beds in the United Kingdom. We bought a large portfolio from Bupa last year.
Of course, yeah.
These homes were not run very well, and as you may have seen, Bupa has been in the press very lately. They were really run very badly. We were quite shocked at what we saw. And last year has been a difficult journey for us in terms of transforming these care homes. And today I'm proud to say that we have removed all the embargoes which Bupa had. Bupa had only 25% of staff having mandatory training. We have 95% staff with mandatory training. So we value our care staff very seriously. And we also like technology. So we have introduced a lot of technology in our care homes. We have introduced automatic medication systems. We have And I introduced electronic governance system for quality management. A lot of things have been simplified in terms of IT systems. So that has been my short journey. So I'm very proud to say that what started as an accident or what started as a lifestyle business to support my career aspirations has become a reasonable among the top 10 private care providers in this country. And we're providing good quality care, and I feel very proud of it.
Excellent. And I mean, it's a fantastic journey and a great story as well. But why does what you do mean so much to you personally?
It does. Everything I do means very much to me personally. I do everything with passion. So when I did my science, I did it with passion. When I operated, I did it with passion. So I was regarded as a very good surgeon. But again, I had challenges towards the end of my career because people couldn't understand who this guy is, who's reasonably wealthy but still wants a consultant job in the NHS. So they said, you are highly qualified. When I went for consultant interviews, people would look at me and say, why do you want a job, Sanjeev? I mean, you're wealthy. So I said, but this is my passion. So I do everything with passion. So I said, okay, I'm going to just focus on my business and I'm not going to look for consultant jobs anymore. And that's what I did, you see. And I met people from the University of Bedfordshire. And because I'm always thinking about innovation, technology, and research, we clicked almost immediately. And when they were presenting certain ideas to me, I said, no, well, we will support you. Why don't we get this up and running? We have our care homes, and it sounds very interesting what you're doing. Let us put it to clinical trial. Let's see what the evidence is, and let's see whether this benefits society. And that's how we got involved in the trial, which the University of Bedfordshire is doing. And we have supported them, and we have thought through things together, and we have come a long way in this journey in a very fruitful manner, I must say.
Yeah, no, absolutely. How about you, Chris? How did it all start for you in the kind of health and social care world?
I wish you would have asked me first because it's painful going after that. I mean, it's such an amazing story. Mine is not so exciting. No, I've always been interested in health, in particular mental health. So I've always had a passion for psychology and mental health. I initially actually wanted to be, I thought I wanted to be a clinical psychologist initially.
Okay.
So I was going into various assistant clinical psychology jobs, looking to find my feet in a particular domain. But in these settings, I happened to stumble across various research studies that were happening. I got involved and quickly got actually promoted to being a sort of coordinator of all research happening across quite a big North London trust, the Barnet Enfield Haringey Trust. And I was doing that at quite a young age in conjunction with my psychology degree. So I got into research really early on. I was very, very lucky to get that position. And that gave me a clear understanding of the complexity of various research, the importance of doing it in an ethical and reasonable and scientific way, and also the impact that research can have on people's health and well-being. So I quickly sort of switched my focus from clinical psychology to research. But in doing the clinical work that I did enter various social care settings, various care homes, and I remember running various reminiscence groups with older adults and having long conversations, and that was my first taster of loneliness, actually. So I'd go into these homes, and this issue of loneliness really struck a chord with me. It was clear that many people just didn't have many people to talk with, or people that didn't really understand how to talk with them and value them. So the concept of loneliness and emotional loneliness really struck a chord with me, and I was very interested in that from an early get-go, and this is a fundamental part of the project that we're in at the moment. But this led me to my PhD, which I did in 2005, and that was on mental health and stigma and cross-cultural attitudes. I've always been interested in culture and how that interplays with attitudes and mental health and stigma, and the importance of culture just generally. I mean, people have different cultural spheres, different cultural lives. Culture influences our day all the time and the way that we think all the time. So again, this is a fundamental part of this project. So the kinds of ingredients that underpin what we're trying to do in this project were there for me in terms of my interests and my experience and background.
Sure,
So.
Got you. And same question to you as well. So why is what you do so important to you personally?
Yeah, so like Sanjeev, I'm also extremely passionate about everything that I do. I want to make sure that I have an impact. That's really what I care about the most, that through my research, through my work, that we can, create an impact, improve people's well-being. Nothing makes me happier, really. Nothing benefits my mental health more than finding solutions, finding ways of empowering people and making people's well-being improve and mental health improve and mental health inequality reduce. So, this really sort of just drives me, this idea that I might be having a positive impact. And I'm a very sort of scientific-minded person. I think about the objective truth and also the subjective experience, and I'm on a conquest for truth, so to speak, and how important it is to find that and leverage that to improve well-being. So I've always just been very passionate about scientific truth and finding a way of improving well-being. So it's all about well-being, I think, ultimately. If people are happy and healthy and living long, productive, happy, healthy lives, then what's better than that, really? So if I can find a way of, through our partners, achieving that or finding a way to help achieve that, then that really drives me.
It's a good, valuable contribution to the world, of course, isn't it? So, okay, thank you for that. So I'm going to change gear slightly, and I'm going to ask some questions kind of to both of you, and either you can answer them individually or together. But can you tell me about what your kind of journey into robotics has been in the project so far, and what that's looked like over the last 3 years long?
Yeah, so the Caresses project started in January 2017, but we'd been talking and planning it very carefully for at least a year before that. The EU has various calls for research, and this happened to be one on social robotics, so we went for it. We knew that it existed quite early on. So good research always takes careful planning, lots of conversation, bringing a team together early on and really kind of figuring out the story and the path. It takes a lot of time. But the project started in 2017. As Sanjeev said, it's been very fruitful. We've had a fantastic collaboration. We sort of harness each other's strengths, and the project has had, I think, an enormous impact on social robotics sphere generally. So, yeah.
Tell me about what's that look like from your perspective, Sanjeev?
No, like I said, that for me, research and technology is very exciting. And anything which can benefit mankind is very personal to me, because that has been my journey all my life. So I thought robotics could make a difference after being in care for 20 years, after seeing the continuity gap, after seeing that when nurses and carers shift, they do not usually, the care plans can only give so much information, but they do not really know the residents too well. There's the same problem we find in hospitals, that you find in nursing homes. And I felt that the robots would be able to address this continuity gap. I call it the continuity gap, because you suddenly have a gap in knowledge. When knowledge is getting transferred, it can never get transferred completely through paper plans. And that is where I thought there would be a big impact which these robotics could do. And the more I understood what the university was proposing, the more I understood the ideas, and the more we started to work together and brainstorm together, it became very clear that it could make a difference. It could make a difference. And I think we have created something now which, as we take it further, will make a big difference.
So practically, what does the trial actually look like within the homes? What does that explain for the audience? Kind of how the practical application of the trial has actually looked like since you've been working together.
Yeah, sure. So as I said, the first stage was really programming and producing the artificial intelligence. That took a lot of time. We need to make sure that it was underpinned with high quality evidence and relevant cultural knowledge, because as I said, this is about making a culturally competent social robot. So what that means is, the robot takes your culture into account while it's interacting with you. And we think that has potential potential benefits for gaining your trust, for acceptance, but also crucially having an impact. We can talk a little bit more about that as the conversation goes on, if you like. But in terms of the trial design, the way that we've done it is that we've focused on 3 cultural groups.
Okay.
So we've got the people that identify with the English culture, people that identify with the Indian culture, and people that identify in the with the Japanese culture. Okay. Those happen to be residents in a care home in Japan. Okay. So we're actually running the trial in Japan and in the UK.
Sure.
The English and Indian residents, they're in the Advinia care homes in the UK.
Sure.
We are trialing it with 15 people in each group. And also, we're interested to see if there's any sort of carryover impact on their family informal carers. So we always ask each resident if we can recruit one of their family carers as well to the study. So we've also got those on top. And in terms of the practical implementation, the practical intervention, let's say, each resident gets the robot. So we have actually 2 versions of the robot because we need to compare and contrast and enable us to ensure that the culturally competent one actually works better than the less culturally competent one. So we've slightly changed things according to that in order to test our hypotheses. But if you have a robot, you get the robot for up to 3 hours a day and 3 days a week for 2 weeks. So that amounts to up to 18 hours on and off across 2 weeks. It's not a requirement that you use the robot. So what happens is we give you the robot. Of course, participants consent and we go through the process. These, of course, are willing and happy participants. We go through all the various recruitment and consent stages. So we give them the robot. We train them initially as to how it works and what to expect. And we're on standby. We monitor and we're right there if required. And the participants, as I said, get to use the robot for up to 3 hours, but they don't have to. And this is very important. We think it would make an impact just knowing that they have a robot to access if they wish. So if they leave their room and go off for lunch, we think psychologically there's a benefit to knowing that if they go back to their room, there might be a robot there there would be a robot there that can interact and talk with and all the benefits that come with that potentially. So they have access potentially for up to 3 hours a day across 2 weeks, 3 times a week. And that's what it is. And we take measures before their experience begins, and then again afterwards, of course, baseline and post-testing measures, and we see how their health and well-being has hopefully improved or changed over the period. And we also talk with them. A very important feature of the study is that we do qualitative interviews. So after the 2-week experience has elapsed, we sit them down, we talk to them about what their experience was like, what they liked, what they didn't like. This is a crucial part of the data collection process, so we can learn from them directly as to perhaps what didn't quite work and how we might improve things if we did it again, etc. And just to say lastly that we really had ethics at the forefront of everything that we do, because there are many ethical issues in this kind of study, and that was something that we took very serious. We had an ethics lead in the project that was completely leading on it throughout, and so very carefully considered the various ethical issues, and we built that into the trial. So there's a lot going on. It's quite a tricky, sensitive, ethically tricky and complex trial happening in the UK and Japan. So there's a lot of juggling around.
Sure.
Yeah.
No, that makes sense.
I think the important thing to understand, what Chris was pointing out, that these robots are working on data that is being provided to them. So you have to have a base set of data, and you need to understand what dementia is all about. So a lot of programming has to go in. So otherwise, they don't have anything to work on. You see, so they don't have natural human intelligence. So once the data is programmed into them, then they can use this data in a more meaningful manner. You see, and that is where the artificial intelligence comes in. So there's a huge amount of work that has gone on before the pilot or the clinical trial could start. That is only the tip of the iceberg. You see.
And what, from an outcome perspective, what have you seen from running the trial?
So actually the trial is still running. It's about to end. So I can't give you any conclusive analyses or interpretations because we have to collect all the data,
Sure. That'd
clean
be very
it.
unscientific of you to
Yeah.
sure.
But
Understand.
very sort of preliminary observations are that on the whole, of course there are variations, on the whole that has been well received, it has had an impact. And we've got lots of learning from it, which is really the crucial thing with science. You know what I mean?
Sure.
It's not to prove the point that this works, it's to actually just learn and move forward. So it's to gain the evidence and move forward. So
I mean, that's what science is all about, isn't it? It's a case of, well, we
that's
don't
right.
know, we need to go
Yeah.
and explore things to go and answer questions.
It's a very dangerous thing when you're doing things without an evidence base. You know, you can't just guess your way through your practices and your policies. You need to have an evidence base, and this kind of project can really achieve that.
And I think what is important is our robots have been properly programmed to examine things in a very structured scientific manner. And many of the robots that you see around the world floating at the moment, they're more gimmicky. Proper evidence and trial has not been done.
Sure.
You see, in different settings and different applications, and that is what needs to be done. So in the military side, we know that in the military side, robotics have been used extensively. You know, there's a lot of evidence there on the military side. But on the social aspects, in the scientific aspects, in industry also you see robots have been used very successfully, but not in the community setting, not in the human setting. You see, and I think this is the first proper trial, if I'm
it really
correct.
is,
It's first proper trial where scientifically we are doing it in a scientific manner with proper data which has been programmed into the robots. Then the whole trial design has been very scientific, and as Chris pointed out, there's a very strong ethical aspect of it. There's a very strong blind arm to it. So everything has been done in a proper scientific manner. So the results that comes out of it would be much more interesting.
Sure. Yeah, absolutely.
It is the largest trial of this kind, certainly in Europe, I would say.
Even in the US, I haven't come across.
Yeah, you're
any
right.
such,
I think just
any
in the
such
Western
trial.
world generally. They do a bit more research in Japan, but in terms of the sort of size and scope and complexity of this kind of study, I think this is one of, or if not the biggest, particularly using the robot that we're using. There have, as Sanjeev said, been other smaller types of robots that have been explored and tested in a sort of more limited fashion, albeit still scientifically and very well. But in terms of what we're trying to do, which is test whether a robot like the Pepper robot, which is quite a sophisticated social robot and looks quite significantly different to some of the smaller gimmicky robots, let's say, whether that through using culturally competent artificial intelligence can benefit people's health and well-being.
But I think it's very important to separate the hardware from the software. So
Yes,
you have other robots in the US as well, the Hanson's robots. So they look almost human because they've got facial features, etc. So they look more pleasing than Pepper. But the software, the information that we have fed into Pepper, that is extremely important. I mean, Pepper would not be able to function without the software that we have created in this collaborative project.
Yeah, 100% correct. Just to re-emphasize what Sanjeev is crucial. It is a crucial point.
Yeah,
sure.
It's not so much about the hardware. Of course, the hardware matters because it enables us to do more things, perhaps through the software. But it's really the software that brings the hardware alive. I mean, a phone without a good operating system is useless, right? It's always about the software with anything.
Yeah.
So our project's really. I'm thankful that you raised that point. Just to emphasize, our project's really about the AI and the software put into an existing robot to bring it alive.
Sure.
Yeah.
That makes sense. And thank you for explaining that. I think that's really useful for me personally, and of course for the audience as well. So, I'm endlessly excited about innovation, technology, robotics. It's something that's very fascinating for me. I guess I've got some kind of unanswered questions in my mind around care robotics. I think the general probably the general concern is that the application has to be right, the interactions have to be right, and ultimately the end user needs to be able to benefit from robotics themselves. And we're going to spend some time obviously talking through that. But I've got some questions kind of in and around that, if you like. So yeah, kind of a bit of a shot across the bow, of course. But yeah, how good are care robots today, from your experience?
So I think the question should be, how good is the software that we have put into these robots? If you look at the hardware, they have arms, but these arms can't do much. They'll move around a little bit, but they can't really do much. It is the content which is very important. So a lot of information has been put to give them an understanding of what dementia is all about. How different communities interact or react. And then the robot, using artificial intelligence, is having an interaction. So it is gaining information from the resident. It already has some base amount of data. It is gaining information from the resident. It is observing behavior. It is observing patterns. And then it is responding. So sometimes we cannot predict the behavior of these robots in the sense of what they will answer, what is the question they may ask. So it totally depends. And that is where the intelligence comes in.
Sure.
So, in a normal program, you would expect that, okay, this is a question asked and this is the answer they would give. But we cannot predict what question or answer the robot will give because of the complex algorithm which has been fed in. And it tries to jiggle its way around to see what is most suitable for, say, Mrs. Smith, or say Mrs. Ali, because they're two totally different, they come from two different cultural backgrounds.
Sure.
And that is the beauty of what we have tried to do, and very different from other robotics. Am I
Yeah, no, you're absolutely right. That
clear
is
in
the
explaining?
unique. Yeah, 100%. That is the unique feature. So if I can give you an example, for example, so so if the robot meets somebody who has said that we know that they identify with the English culture, for example. So we pre-program that into the robot. We said this person identifies with English culture, and then the robot loads up its cultural knowledge database. So it loads up everything it knows about English culture, including what it thinks English people value in particular or don't value. So it's making best guesses about people's values and preferences based on their cultural background. So, for example, the robot might initially start, by asking a question. First it would start with the various niceties, standard niceties, but beyond that, it might ask a question like, do you like football or rugby or cricket? Because these are culturally relevant, usually valued or preferred types of sports than, for example, sumo wrestling or baseball.
Sure.
It would be strange if the robot out of nowhere initially just asked the question, do you like sumo wrestling? I think that might different people respond in different ways, but it's more likely to throw someone if you get a question like that, as opposed to, do you like football? And it could be that you do like football, and that's great. Then you can start talking about your passion for sport or, whatever it is. But then again, it may be that you don't like football or rugby or cricket, and you're not the stereotypical English person, and you do happen to like sumo wrestling. So it can happen. So that's individual variation, right? So the English person may say, I don't like rugby or cricket or football, but I do like sumo wrestling. Can say that to the robot, right? You can say whatever he wants, or she, and the robot will then know that person actually prefers sumo wrestling as opposed to football, cricket, or rugby. And then so that's how the artificial intelligence works. It's quite sophisticated in that now the robot remembers that the person likes sumo wrestling and will remember that for future conversations. But also the robot will begin to make guesses that perhaps the person likes other elements of Japanese culture. So it might bring up conversations about Japanese food or Japanese music. And let's say, for example, the person liked Japanese music. The robot can then ask whether he or she would like to hear a nice Japanese song or watch a Japanese movie, and it will play it for it. So it's leveraging cultural values, you see, but crucially not staying with the stereotypes. It has to learn and adapt to the individual person. But initially, it does leverage what it knows about culture. And you and I would do that ourselves, right? If you went to America, for example, and you met a random American person and you started talking about sports, I think it would be odd if you said, do you like, if the first question you asked was, do you like I don't know, cricket. He's American, right? So you'd load up everything you know about American culture, and you might guess, oh, the person likes, NFL or baseball or basketball. So you might ask that question. So it's these kinds of ways of thinking that try and tap into preferences, and what's valued. That we're trying to leverage and get into conversations. And as I said, there are various reasons why we do this. One of the most important is that cultural competence has been shown in the nursing literature to have a real impact on patient outcomes. So when staff are being culturally competent, they're asking questions and showing an interest and an understanding of somebody's culture, and then adjusting to the individual cultural profile that person has as they get to know them, that has been shown to translate into better patient outcomes.
And if you look at England today, it's a cosmopolitan culture, cosmopolitan society that we are living in. You have cultures from all over the world. I call it mini planet Earth. And that's the beauty of living in the UK. At least let's see what happens after Brexit. But that's a joy. But just to go back on the artificial intelligence point, it's very similar to the Google search. So when you're doing a particular search, the Google picks up that, okay, this is what interests you. And next time, before you even start to do the search, it will show you all sorts of things based upon that liking that you have initially shown. You see, so the search is bringing up, and all the marketing preferences are based upon what you have first inserted. So you can just imagine it's like a Google search, which is a complex AI platform in itself.
Yeah, so it's adapting and learning. One way in which it's different, though, to Google search, which I think is interesting to know, is that if, for example, with a Google Assistant or your phone, let's say you ask the phone, who is Lewis Hamilton, right? The phone or the Google search will come back and say, according to Wikipedia, Lewis Hamilton was born on and is a Formula One driver, right? In a sort of factual, but it will say according to Wikipedia.
Sure.
Whereas the way we designed it is that the robot has to take, more ownership for what it's saying, in the way that you and I would. If I asked you who is Lewis Hamilton, you wouldn't say, well, according to Wikipedia.
Yeah.
You would just say, oh, I think Lewis Hamilton is a Formula One driver. So it's more natural in that way, and so that's something else that's interesting to note that we've put into the AI, in that it will try to take ownership, and yes, it will derive a lot of its information from online and what we've programmed it, but it will talk in a more natural, accepting kind of way.
And you can see that in the interactions which the residents are having, can actually see it. The robot is pausing, the robot is thinking. It is not just it's an automatic answer within a couple of seconds.
Yeah.
So you can see that pause happening. So it is very, very human the way the robot is interacting. And it's quite interesting. You're seeing a dementia resident interacting so nicely with a robot. Much more nicely than with a carer, because the carer is always in a rush. You see, but a robot is there listening to you patiently. It's not in a rush to go and do something else or going to attend something else. It's totally focused on you. And that attention is quite interesting for me when I was watching the interactions.
Yeah, and the fact that the conversations just can flow and go on back and forth is crucial. And again, another sort of standout element to our sort of solution, our approach, compared to, let's say, an Alexa or a Google Assistant. You can't have a conversation with those things.
Sure.
It's the conversation that really counts often. Talking is good for you, especially when you feel that that conversation is being valued and understood. That's crucial.
Sure.
It's good for cognitive health. If you talk, you're thinking. It's just good to process and think, and that's, as I said, good for cognitive health. And it's good for just general psychological well-being, and that then translates into general good quality of life. So talking is a crucial way of forming good health. And so we need to find solutions like this that can boost one's likelihood of talking, because so often older people in social care don't have anyone to talk with. The statistics of loneliness is staggering, right? Reports sometimes suggest that people, haven't spoken to anyone in days, sometimes. So that's shameful. We need to find ways of alleviating that, and this is one good way.
And I think the other thing that I was talking about, the continuity gap. So because these robots are registering information, new information from the resident. So for example, what Chris just said about the sumo wrestler, while the robot is interacting with an English person. So now the robot knows about it, that his liking is sumo wrestling. And he will know other preferences from that particular person. If a new care worker comes in the evening, or say an agency worker comes who doesn't know anything about this resident and who's doing something different or interacting in a different manner with the resident, and that particular resident has got dementia, they've already forgotten the events of the morning, right? So then the robot can plug in that gap. It can explain to the carer that, no, Mr. Smith likes sumo wrestling. Why are you bringing him all these things about cricket, and why are you showing him things about cricket and football? He doesn't like it. You see, there are lots of things. I'm just giving a simple example, but it can go into a lot of more complex information sharing with the agency worker or with a care worker who comes on shift next time. And I think that is extremely valuable in the care sector. If you can address the continuity gap and you can allow care to move seamlessly, if the information flow is seamless, it will automatically translate to better care from the caregiver. So the robot is not about giving care. They cannot give care. To design robots which can give care, I think is at least 2 or 3 decades away. And these robots are not designed to give care or to administer to the patient, to the resident.
I think that's probably where a lot of the misconceptions come from,
absolutely.
and I think that's something that's going to be important for us to talk about in the show. But so tell me about, so how do you see care robots being perceived by like the kind of the populace, if you like? What's the general conception, if you like?
So if people would initially, with any technology, any science, when people don't understand, they will be confused. Some people will be angry about it. Some people may think that technology is going to replace jobs. But technology needs to be seen in today's world as enhancing lifestyles, not about replacement. You see, and that is what these care robots have been designed to do. Is to, again, as I was pointing out just a couple of minutes earlier about the continuity gap, by helping on the loneliness side of residents. You see, so you have a patient person, you have a patient robot listening to you, talking to you, having an open-ended communication with you. That is going to reduce a degree of loneliness, because a lot of people do not have the patience to talk with a resident with dementia. It requires a lot of effort and patience. Even family members don't have that patience. After 15-20 minutes, it is an exhausting experience. And sometimes it can be emotionally unsettling as well for the family member when they find that the mother or grandmother or relative doesn't recognize them, is forgetting important events which is meaningful for them, so they can break down. And here you have a robot which is understanding, which is patient. So we feel that it has a very important role to play, depending upon how people perceive it. So people need to understand that these are not going to replace care workers at all. They cannot give care. They do not have the limbs to give care. They are just there to help care workers perform more efficiently. And once this message goes out, I think a lot of the misperceptions will go away.
What's your view on
No,
this?
I mean, I agree. I think a lot of the fear is about this idea that robots could replace people's jobs, and obviously that's a fair fear to have. I mean, ultimately, people's jobs and their livelihood are fundamental to their well-being, and we're all in the game of population well-being, right? So we're all about making sure that everybody is benefiting and there aren't any losers. So we're not proposing at all that these robots would replace people's jobs. As Sanjeev said, it's about finding a way in which they can complement and augment and enhance existing provision. So it just is the case at the moment that social care is very stretched. There isn't as much funding in it that there should be, and elderly people are often left on their own, and loneliness is the real thing. I don't think anybody can deny that loneliness doesn't exist and that it's poison to mental health. So given the reality, this is a way perhaps to help alleviate some of the pressures in social care, as opposed to swap out existing care and bringing this solution. I mean, that's not what we're testing in our study.
Sure.
I mean, in our study, it's not about swapping provision out with this. It's about, does this help within the current context and portfolio of care? But that has to be very carefully treated, because even if you're not replacing staff and care in an existing portfolio, even just having a robot on site could have an impact on staff morale. You have to carefully train staff to understand what the robot is there for, why it's important, and what it can do to benefit your residents. And here's the evidence that shows that. And bring them on side, because if you don't bring them on side, then I think that might perhaps fuel the negativity and the problems that staff have now with their morale. And morale, we know from evidence, staff morale is critical to good patient outcomes. If you have staff who are happy and enjoying their work and find value in what they do, and they have good morale, then it obviously translates into better patient outcomes, better patient care. So we've got to find a way of making sure that this system not only benefits residents' loneliness, but also doesn't harm staff morale. And that can be done through showing them the evidence, through training, and through bringing them on side. But also, I think the media has a role to play, because it's the media that are often the ones that, through sensationalist headlines, create a kind of public feeling of fear
Anxiety
and anxiety about robots.
How they
Because
sell
it's
their papers.
sensations. That's how they sell their papers, and they don't talk about the evidence. In fact, if you look at the evidence today, there's been a couple of very, very sophisticated, systematic reviews that have looked at all of the trials that have been done. As we said before, they are smaller scale and with smaller types of robots. But even those have shown quite consistently that they can have an impact on patient outcomes, that they do, in fact, compared to not having them at all. So the evidence is actually quite good and indicates that they have a place and can improve health. So, but of course the media don't ever. That's a boring story to tell, isn't it? To talk about evidence.
Never going to sell any papers.
That's about, you should be worried about your jobs, and that's a problem for us. So I think we have to be talking. I think we have to be, really talking with the media industry about sensible, dissemination, sensible, reasonable dissemination, because they have an impact.
I think we employ almost 4,000 care workers in the country, and we haven't seen any anxiety. People have come to know about the robots, people have had them in the care home, and there has been no anxiety, because they realize when they see the robot, this robot can't give care. It is not designed to give care. It is not designed to replace them.
Sure.
It is like a very advanced computer system, which is helping them in their interaction. So once they understand it, people are absolutely comfortable with it. We've had no issues with relatives. We have had no issues with residents. We've had no issues with care workers or managers. Once they see and once they realize what they're doing, they're absolutely happy with it, because they can see the complementary nature of the role these robots are playing.
I mean, that's the most important thing, right? Is the resident, is their well-being being improved by the robot? And obviously the opposite end of that is that, are there any negative implications? And if your experience has been that there's been none for them and that none for the team as well, that can only be a positive outcome, can't it? If I guess now that hypothesis has now been kind of proved, if you like, it's a case of, okay, so what can we do here to keep improving things, to drive the improvements in the residents' well-being from the perspective of the AI, and then to improve the interactions, to keep it's basically about driving improvements in that sphere, if you like, as well. So I think that segues nicely to this in some ways. But why is the cultural competence of the robots so important? I know you touched on that slightly, but I think it makes sense to unpack that a little bit more.
So if you think about it, our cultural upbringing is very important to us. We are shaped to a certain extent by our culture, and then our environment shapes us, education shapes us even more, then interaction with other people shape us even more. So these are the different phases of learning and evolution that we all go through. And these are very important to us for our own well-being as human beings. So loneliness, anxiety, lack of understanding, lack of empathy, all these have a very important bearing on your mind. And many of the people that we look after, the older people, they have Alzheimer's or they have advanced dementia, and many of these cognitive abilities have reduced. It hasn't disappeared. It has reduced significantly in some of them. In others, they may have reduced to different degrees. And as other people cannot empathize, a care worker doesn't have the time to empathize mostly. They come for an 8-hour shift, 10-hour shift, they're focused on delivering care, they have a lot of responsibilities. So they cannot really have the time to interact with the residents so much. And particularly in today's time, when the cost of care has gone up and you're not being paid the fair fees for care, so everyone, all the care, the whole care provision is centered around ensuring that the staff are used in a most optimum manner. You see, so staff come on the job and they just do a particular piece of work, but they don't have the time to sit back and relax as they used to do 20 years back. When we came into the industry, it was very, very different. So I think from that perspective, the care robot and the way it has been programmed will have a very important role. It may help to reduce anxiety. It will show more empathy by having more patience, by listening to what you are saying very carefully and then responding to it rather than completely in an artificial manner. And those things are extremely important for the other person. You see.
Sure.
And I think over time, I'm pretty sure. I mean, these are not the endpoints of our trial. I must clarify that. But over a period of time, I'm sure that there will be data that will come out as we implement these robots in our care homes that will show that residents are actually benefiting. Their anxiety is reducing, their loneliness is reducing. That is again something which we are presupposing, and we have to see over the next couple of years.
That makes sense. What's your perspective on the cultural competence side of things?
No, I agree with what Sanjeev said. I mean, for me, cultural competence is proven to be important. That it's evidence. The evidence is there that it makes a difference, and it's obvious, really, if you think about it, why culture matters. Because what you're doing is, if you're leveraging cultural understanding, you're able to tap into what is meaningful to people in their lives, in their own lives that they've experienced in their world. And that is what culture is all about. And, so when you play, for example, if you play somebody a song that, really, it means something to them personally and was part of their childhood, and, the power of music, in dementia is well known. But again, that link that taps into the importance of culture, because you're playing a song for this person that was part of their life, part of their culture. You're not playing something that is, outside of that sphere and doesn't have any meaning and value to them. So that's why it's important. Culture just simply enabling us to understand cultural knowledge and values, and enables us to leverage what is meaningful and valuable to that person's life. And interactions that bring that value and that impact are going to improve patient outcomes. It's pretty obvious, really. I mean, if you just take advantage of that, it's going to help, isn't it? So that's what we're doing. We're trying to find a way that will get to the interesting, meaningful conversations that are valuable and are of some sort of meaning to that person's life, more quickly, or doing it at all. In some instances, it may not ever happen if you're not culturally competent.
Sure.
So it's just about really generating powerful, meaningful conversations, memories, feelings, thoughts, and that is great for health.
I mean, I'd say that was probably one of the key benefits of the care robots. But what would you break down for me, both of you, kind of what you see as being the core benefits of robots in care?
So, as both of us mentioned, to summarize, I think they're about understanding your culture. It is about interacting with you in a competent manner by understanding your culture. That helps reduce anxiety. It is understanding information that you are providing or new information that you are providing, storing that information and being able to communicate that information to another person when your own cognitive abilities have declined or will continue to decline, as is obvious in various types of dementia because it continues to decline over a period of time. So from these perspectives, the robots have a very important role to play. And I don't like the term care robots because they are not care robots, you see, because they cannot give care.
Sure.
They are companions. They are robotic companions which are allowing people to, be understood better. So I don't know if I have to give one
it's a bit of a
name,
misleading term.
one term, to it. I would probably call them socially competent robots rather than care robots. Because that's a total misnomer.
Yeah, or socially assistive.
Yeah, or
robots.
socially
Yeah,
assistive
yeah,
robots.
Yeah.
That's an interesting learning for me and probably quite a lot of other people as well. Because I think if people understood that public perception would be quite
Shifting.
different, because that ultimately those are two different things, right? But I think the general consensus, if you went and asked the average person kind of in the health and social care sphere, they'd say, oh well, that's what's going to take jobs and it's going to try and deliver personal care and all of that type of stuff, which it's very clear that it's those two things aren't there.
So these are not industrial robots. So the industrial robots replaced manual workers, through increasing efficiency. But this is not supposed to do that. These robots are actually socially, they're companions. You see.
Yeah, there are different types of
There are
robots.
different
I think,
types.
yeah, we shouldn't get confused about the various types of robots that are out there. I mean, we're talking really about socially assistive robots, as Sanjeev said, that are talking, interacting, trying to improve cognitive health, mental health through that verbal interaction, as opposed to, robots that, monitor falling or clean even. You get the Roomba, is that what it's called? The automated vacuum
thing.
cleaner.
Yeah.
I mean, that is a robot, but that's a very different type
Completely
of robot,
different
isn't it?
animal. Yeah.
So, there are many different types of robots, but those that are really designed to improve mental health and quality of life through social interaction have so far been evidenced to do quite a good job. But the evidence there's some question marks that hang over it because of the designs of the experiments that have been taken place so far. They're quite small and less rigorous, let's say, than the project that we're doing.
What we have done. So we have done it for over 3 to 4 years. So it has been properly done, well thought through, and implemented in a scientific manner. And although over the last 1.5 years there has been a lot of media interest and thinking that they're going to replace care workers, we have continued to maintain our focus that no, this is what these robots are supposed to do, this is what the endpoints of the study is. Let's get the endpoints out, let's understand what the true outcomes are from allowing residents to interact with these robots, and then present the data to society and to the world at large for them to decide as well and to understand better.
I think that understanding
Is very important.
Yeah, absolutely, definitely. Again, it comes back to the perception thing again, doesn't it? So, there are different types of, let's say, socially enabled robots for older people. What are the different types that are available as it stands today?
Okay, so there are actually a number of different socially assistive robots. Probably the most well-known one is probably the Pepper robot, which is the one we're using at the moment. That is a very well-known robot. It's used in various places, not just in social care, but in hotels and shopping malls and entertainment industries, all sorts of different places.
But with a different software. It is
very,
not the
very different software. Yeah.
which we have.
Same hardware, different software.
Different
right?
software.
Yeah. So although it might look the same, the underlying
Interaction is totally different.
completely different. Right.
Yeah,
Sure.
yeah.
Yeah, that makes sense.
There's also the Paro robot, the Periosteal Robot. That's also quite a well-known robot. It's a sort of a plush toy which looks like a seal and makes various purring noises and movements to sort of mimic a little baby seal. And that's actually been trialled quite a lot in research and with people with all ranges of dementia actually in social care. and that's had good outcomes actually.
Have I seen
Yeah.
maybe cats and dogs as well, kind of a similar ilk?
Yes, yeah, there are those small robotic dogs and cats, and also there's a little robot called the Now Robot. I don't know if you've heard of that one. It's a sort of miniature Pepper.
Okay.
And a whole flurry of other robots actually. But really the sort of main, larger humanoid-looking robot, although it's not really humanoid-looking, it's a sort of 4 foot, tall, human-shaped, let's say, kind of robot is Pepper. But I think one of the nice things
reminded
about
me of D2
yeah,
in Star
yeah,
Wars.
yeah,
you know?
yeah.
It looks like that with big eyes and
Right. Yeah.
just nods very gently.
Got it.
Yeah. But it looks quite. I mean, it's got. You have to say, Pepper has got a nice look to it.
Yeah.
I mean, it's quite. It's not very threatening, and in
Sure.
fact, some of the robots that look more like humans are more problematic and less accepted because they look. Sometimes they can look quite creepy, can't they?
Yeah.
The more close they look to human,
That may-
but not quite exactly human. Something
Just ends up
off
feeling
about
a
it.
bit weird. If
Yes,
it's clearly a
yeah.
robot, then you just know that it's a robot.
Right.
Obviously, you can.
Yeah,
You can
that's
make
worse. Yeah, but the nice thing about Pepper is that it is clearly a robot. It's not trying to look like a human.
Sure.
And I think that's one of the reasons why we chose it actually for the project. But as we said before, it's the look is nothing without the brain. Without the software and the AI that goes into it. So. Yeah.
So, from the perspective of care-assistive robots, what does that look like? Do you see over the next 3 to 5 years? Because I'm sure this body of work will contribute largely to that. But yeah, what do you see in the kind of short to medium term, if you say?
If you look at things now, we know about artificial intelligence, but people are already working on synthetic intelligence. And synthetic intelligence is what mimics the human brain.
Okay.
So artificial intelligence, you give it certain sets of algorithms and certain data, and it uses the data to learn a lot more. So that is where machine learning comes into being. But synthetic intelligence goes in a totally different way. It actually, because the human brain functions by creating interactions with different parts of the brain,
Sure.
as your learning happens. Yeah, so they're now trying to create the synthetic brain in petri dishes.
Right, okay.
And that is synthetic intelligence. And what this is doing, these robots are doing, the way the programming has been done, although the programming is based upon artificial intelligence and machine learning, I would say they are mimicking synthetic intelligence a lot more because they're learning through their interaction with you. And I think this aspect of artificial intelligence, which is moving into the domain of synthetic intelligence without creating artificial brains, will continue to evolve as more and more data comes, and as the software gets more sophisticated. Their ability to understand things and ability to pick up things and to be more sensitive to whatever you say and to be able to communicate with you in a much more realistic manner will improve drastically.
Got you. Chris, what's your...
Yeah, no, I agree. I don't see too much change actually within the next 3 to 5 years. I think there'll be a slow shift, for example, in more use of socially assistive robots in social care. But there won't be any drastic. I can't see there being a drastic, sudden shift for every social care setting having a fleet of robots assisting. I don't think we're there anyway. I think that would be a very dangerous position to be in because we need to be evidence driven. So we need more studies, more rigorous research to make sure that we're not rushing into just a very clumsy, extreme outlay of robots in social settings. I think we have to be considered and grow this slowly but effectively and ethically. So it's just about finding what works and why it works and what happens to also have the least negative outcomes for other populations. I'm thinking about staff in particular. And that's something that takes a lot of time. You can't just rush into that. So I don't personally see much of a shift over the next few years. I think we've got a lot of conversations to have.
No, but I think because we have been looking at continuity gaps, we have been looking how to reduce anxiety. I'm a bit more optimistic than Chris Chris is conservative like a scientist. I'm a bit more bullish. I'm a surgeon and a scientist and an entrepreneur. So I come from a slightly different perspective, not so much conservative. I think these robots will have a very important role to play in giving social assistance, and they can reduce anxiety. And if you can even prove that they can reduce anxiety by 10%, that has a huge clinical
Big thing.
impact, huge clinical impact. So, and that can reduce the pressures on the care staff. Because if you have an anxious resident who's not understood, and people are not patient with the resident because of their degenerative nature of the problem they have, it can create a lot of pressure and stress on the care worker and can consume a huge amount of resource. So from that particular perspective itself, I feel these robots can have a very important role to play, at least from the interactions that I have seen. So I have seen an interaction with an English person, I've seen an interaction with someone from an Asian background, and the robot is able to interact with both of them equally well. And
that's
they
true.
both take to them, very, very well.
That is true.
And
There's-
it is engaging. So 1 hour is passed by, they don't realize it.
yeah,
Sure.
You see.
that's great for health and
Yeah,
well-being.
that's really
Yeah,
great
yeah,
for health
yeah.
and well-being. So I'm a lot more optimistic and bullish than Chris is.
No, I just to clarify, no, I do think that there is clear clinical utility. I mean, there's no doubt that this has impact, and that's the crucial part. I'm just not sure about the
fleet
rates,
of robots.
the rates of uptake. Yeah,
Yeah,
because we have a
no,
lot of stigma to push through.
Sure.
In
I
the
think,
UK.
So I think the
Yeah.
rate of uptake will be slow, but you don't need a fleet of robots. You need maybe one or two robots
Yes.
depending upon the size of a care home.
Yeah, correct. Yeah.
You see, and that robot can function very efficiently, and they're not that expensive. The actual price of the hardware has really come down. It's the price of a large plasma TV, for example.
Sure.
And I'm sure it will keep on coming down.
Yeah.
Oh, of course, yeah. I mean, the more the market adopts, the lower the cost of manufacture, etc. So yeah, that cost point will come down over a period of time. Yeah, okay, that's interesting.
It is cheaper than recruiting, a lot of staff, because the cost of getting one robot in a care home, which can help you reduce anxiety, which can provide a companion, and reduce the pressures and the stress on care workers. I mean, I think the impact would be very, very significant.
And also there are
And
other
the care
costs.
homes will really, so like on a couple of weeks' time, we have a special session just on socially assistive care robots. Because people are already understanding how much benefit these can provide.
Sure.
And also there are other kind of cost savings that brings, right? I mean, if staff morale improves because they can see they're in a high-tech environment and they are on side, and also crucially patient outcomes and patient health improves because they are less isolated, less lonely, more cognitively interacting and all of that good stuff, then of course better health equals less cost, right? So there's those knock-on cost savings that come with good health, good patient health, and happy staff.
Understood. That makes sense. And okay, so let's say socially assisted robots and also the wider kind of care robot sphere, if you like. What do you envisage for the future? So let's kind of look a little bit further out onto the horizon, if you like. What can you see happening in the future?
I think many of these robots will get technologically more enabled. So rather than only being a social companion, I feel that a lot of sensors can be put on them, so they can actually see if a person is falling. And if they are falling, they can't prevent the fall, but they can trigger an alarm immediately. You see, so they can see. They can also, hopefully, as the technology improves, they can do remote sensing of heartbeats, of respiration. You see, and of your body measurements, and a lot of these measurements can be communicated to the care staff, even if they're not in the same room.
Sure.
So if there's a change in any of these physical parameters which can spell danger, the care worker can immediately come. The robot can give a signal that there's something not right over here, can you please come? So I think slowly these robots will get more sophisticated in detecting not only your mental and cognitive abilities, but also your physical ailments,
That makes
and
sense.
communicating that. But I think
Yeah, I
that would be
agree.
a natural progression.
Yeah, I totally
There's a lot
agree.
of good sensors are now there on the marketplace.
Yeah, the
which
big
need to
shift will
evolve.
be hardware. no doubt about it. As Sanjeev said, the robots at the moment, I'm thinking about Pepper in particular, it's not able to do too much. It's really just about talking. It's got a tablet on its chest and it can play music and videos. But beyond talking and using the tablet, it can't pick things up. It can't monitor whether or not somebody has fallen, or what their physiological state is. It hasn't got that sensory capability. So I think if we're talking, middle to distant, far future, robots 100% will get more hardware-wise, more effective, to the point where I can see them, just being instructed to go and make a cup of tea and doing that, or making the bed and doing that, or, as Sanjeev said, more sort of care-orientated functionality.
That will come a long way. I don't think that is going to be happening in the near future,
not
because
near future.
Creating sophisticated limbs is very expensive.
Yeah,
So
sure.
I was with a robotic company, and they said to add each simple limb, just a very simple limb, which is able to lift and put something down. That costs $50,000 just to add one limb. To create 4 sophisticated human-like limbs,
Sure.
it will be prohibitive.
Yeah.
I don't think that is going to happen in the near future.
Not near future,
I
absolutely
think
not.
it's 2 or 3 decades away if it
At
happens.
least, yeah.
But I think the robots can have a very important role in sensing physical ailments as well. You can have very sophisticated sensors which can trigger off if, say, a resident is falling, or can sense your respiration, which it can. Because it causes fluctuations in the environment when you respire.
I mean, we're already
a lot
working.
of things are already available in the marketplace, but these could be integrated within one robot to make it much more meaningful.
Sure. Sorry, you could.
No, I was just going to say that I agree completely, and we're actually already working on some of these things already. So, for example, recognizing emotional state is already being worked on. So there's lots of AI and software and hardware that is working to understand, just by looking at you, what your likely emotional state is, even your personality. It uses obviously various AI and algorithms and machine learning and makes guesses. But that's happening at the moment, but in early stages. But for sure, in the future, this stuff is going to be far more sophisticated and ready to go and have an impact potentially in the future.
I mean, we live in a world of increasingly where we've got smart homes, whether that be kind of Alexa. I think the one example I really like is the kind of the fridge that just orders your food for you, so you never have to go and do your Waitrose order or go to the shops or whatever. But that type of stuff is going to be increasingly adopted, of course, within care homes as well. So be interested to see how any type of socially assistive robot could then interact with that kind of wider smart home tech infrastructure, if you like.
Yeah,
as well.
you're talking about the Internet of Things, aren't you? Sort of connected tech environment. Yeah, but I think, as Sanjeev said earlier, I think probably the future is not like that. If I was to make a guess, I would think it's more centralized and localized to one tech product that does 80% of what others can do.
Sure.
Okay. And I think that would be easier. Whatever is going to be easier and more accepting among humans. What's the sort of easiest, straightforward way of interacting with tech is going to. That's what's going to win out, I think. Rather than have to interact with 10 products, if you can just interact with one that can do most of everything that you want in a streamlined, simple fashion, then I think that's what's probably going to win out. I think it's important to state that I don't think anyone wants to envisage a future where it's just all robots delivering care, and humans are out of the picture. I mean, who wants to envisage that? Humans obviously are incredibly sophisticated and capable of anything that most robots could ever achieve. So what we want to do really is find a way of having the two help each other, as I said earlier, assisting and complementing each other. And it would be a shame on the other side of the coin if it was just humans and no tech and no robotics when it's been proven and evidenced to have an impact. And the reason why we're not using it is because of fear and stigma. We shouldn't let fear and stigma stop us from benefiting from technology that's been evidenced to be potentially effective in improving well-being and can do so in an ethical way. So we shouldn't ever let fear stop our objectivity about what works, and to implement that.
Then I think if you look at the data, the number of the aging population is increasing throughout the world. We do not have enough young people to be looking after them. So there will always be a shortage of care workers, people who will be able to look after the older people. And if they are more stressed, if they have to sit down for 2 hours and spend time, dealing with an anxious resident, that will take out a lot more, that will require a lot more provision of care workers. So I think these robots, if used in the right way, can play a very important role. Any instrument, any technology, if you use it wrongly, it can have a disastrous effect. So nuclear energy can be used to create power, it can be used to kill people. The knife can be used to put butter on your bread, or it can be used to stab someone. So it depends upon how you're using it. And a judicious society must know how to use technology in a sensible manner to benefit mankind rather than do it in an opposite manner. And that's where our beliefs come from.
Yeah, well said.
So I think technology is going to continue to help us advance things and make things more efficient and meaningful for people.
But we mustn't let stigma and fear
never.
and misconceptions stop that from happening.
I think there will always be people who will be ignorant. There will always be people who will be fearful. There will always be people who will think that the world is going to end. But the world doesn't, fortunately, there's enough positive and realistic thinking people to make this universe and planet work. And that is what we are focusing on.
I guess.
And that is where most of my energies in my life has always been focused on. Think about the positive people, think about the people who are realistic, forget about the negative people who think that the world is going to end.
Yeah.
Then you just get sucked into a negative whirlpool.
It's very true, isn't it? It's, I think you both mentioned kind of objectivity with all of this, and the objective truth, it sounds like from what you've said, is that there is a positive upside. Obviously, we'll hopefully know in the not too distant future kind of to exactly to what extent. So maybe we do another episode in a year's time once you've had an opportunity to be able to kind of start looking at the results and things, so we can
Maybe we can send
work
our
on it.
robots for the interview.
Yes, an episode with the robot. Yeah, just
That
the.
would be, that
Maybe we
would be
can send the
awesome.
robots for the interview.
Yeah.
Don't worry, it's not going to replace your job. Okay, you'll
Sure,
always be a
sure,
podcaster.
right?
Yeah.
Okay, that's good. Feel good about that. So, okay, well, for me, just as much as anyone else, trying to form my opinions on this, I feel like I have a far better understanding of what it is specifically that you guys have set out to achieve, but then also that. Again, the objective truth of kind of where we sit from the perspective of these types of robots, and it has been absolutely fascinating. So, firstly, thank you, gentlemen. It's been great. There are two questions that I like to be able to ask all of my guests before I wrap up any interview. The first one to you, Sanjeev. So, if you were to give somebody looking to make a positive impact in the care sector one piece of advice, what would that piece of advice be?
Whatever one should do with passion, right? And one should realize that the older people, they have lived a very fruitful, productive life, and it is now the turn of the younger generation to help support them. Because one day we will be in their stage,
Of course.
and we do not want our younger generation to feel that we don't care, because those messages get passed by. And that is very important, and that's the one thing which I want to let the younger people know.
Passion. You started.
Passion, and look after people, because we are human beings. We have to care for people. We have to be compassionate. We have to empathize with people. If we don't, there's no difference between us and robots. The robots may take over if you're not careful.
Absolutely. I think that's really, really useful. How about you, Chris?
No, I fully agree with Sanjeev. Just be compassionate and kind, treat people with dignity and respect. Remember that they're humans just like you, and if you don't care and don't care about doing that, and you don't love your work, and you're not putting thought and care and consideration into it, then you're not in the right sector.
Sure. Yeah. No, I couldn't agree with that anymore. No, two fantastic pieces of advice there. Last question: what's the best piece of advice that you've ever been given, Sanjeev?
To live your life with passion. You have been given this one opportunity on planet Earth as in a particular identity, and you must do everything with passion and express the full creative potential of your soul 100%. And that is a way to live, and that's how I live.
You can tell that's something that's really very important, but also something that you embody on a day-to-day basis as well. So no, that's good. How about you, Chris?
Work with Sanjeev. That was
Just
the
work with
best.
Sanjeev.
Yeah, that was the best bit of advice. No. I mean, I think the best piece of advice I've been given is just to always be yourself and be kind and respectful and considerate in everything you do, and just give 100% into it and try and make a difference. That is what it's all about. Try and help others, but do it in a way that's true to yourself and be kind and respectful. That's always been the advice I've been given and a sort of mantra I try and live by.
Very useful and very powerful advice. So, gentlemen, it has been an absolute pleasure to have you on the Care Home Show. Sanjeev?
Thank you very much for having us on.
Really good to see
Appreciate
you.
it.
Thanks,
Chris,
Simon. Thank you very
absolute
much.
pleasure.
Thank you.